Welcome to Simulation at Bakersfield College Nursing Skills and Simulation Lab. We do simulation in nursing because research has shown that when students participate in simulation, along with the learning they do in their classrooms and the learning that they do in the clinical facilities, it helps improve their confidence, their competence, their communication skills, and their teamwork. This is important for nursing students because we want them to have a chance to go out and not be anxious in the clinical setting when they are working with patients and nurses, and be able to do skills and give medications and nursing care safely. So the idea behind simulation is we create a safe space where things are confidential. If a student makes a mistake, we talk about it in our debriefing and talk about ways that might prevent that in the future, how they would do things differently. And the students are coming up with those ideas themselves. And they know once it's discussed in the debrief, it does not go anyplace else. So they feel safe trying things that they think are right, whether it might be lead to the best outcome for the patient or not. The other thing that we find that simulation helps with is patient safety. And so they are able to come in and practice things over and over again with patient safety in mind, coming in a room and making sure that the bed is down in the lowest position, the rails are up, there's nothing on the floor that a patient who is able to get out of bed might trip on, and those sort of things. And so it allows the students to practice patient safety, practice communication skills, walking in a room, introducing themselves to a patient, letting them know what the plan is for the day, developing that therapeutic communication and that therapeutic relationship with the patient. SIMS brings all of that to students so that they can combine that with what they are learning, be able to take it to the clinical setting, and be able to be safe practitioners of nursing. Simulation is vital to nursing schools right now because of the lack of clinical placements that we're finding, not enough places to put our students, and we need more and more nurses. And so we find that simulation is a very good solution for that problem and gives students a chance to practice scenarios that they might not see in the clinical setting because they happen less frequently, but they can still practice them and know what their response would be and be able to respond appropriately. So simulation is vitally important to nursing students. The students really enjoy simulation. They feel like they are learning. It's very concentrated learning, and it is in a safe environment. And they take those skills and take them out to the clinical setting with real patients, and the patients benefit from what the students have learned in simulation. So thank you for helping us celebrate Simulation in Healthcare Week.